Hello, everyone, and welcome. My name is Raj Kumar. I am the President and Editor-in-Chief of DevX, and I want to welcome viewers who are joining us from all over the world for what is a really critical session at an important moment in history. You know, we've kind of run out of adjectives for describing the situation that the world is facing today due to this pandemic that has gripped societies all over the world, that has affected all people in different ways. And we have a very special event that we are bringing you today, and I'm honored to have been asked to moderate this session. It's being brought to you by the World Health Organization and by the UN Population Fund, along with a number of partners, including the UN High Commissioner for Human Rights, HelpAge International, and including UNDESA. It is really a collaborative event that I think highlights the new moment of collaboration across the UN system on a critical issue on everyone's mind today, and that is the rights and well-being of older people during this pandemic and even well beyond. And we're going to have a dynamic conversation today with a number of leaders, a number of experts. Some you may know well, others you may not, but I promise you will learn something interesting today. So I thank you for joining what I think is a critical session. One way we want to start the session today is to bring you the voices of older people from around the world, because a key underlying theme of our session is that in the end, a virus which is affecting older people in disproportionate ways is not just about a health issue, it's also about a rights and dignity issue. And we need to first and foremost listen to older people. And so we're going to begin our session with that basic understanding. And I want to play for you a short video, just a minute long, but I think you're going to find it very revealing in terms of hearing the voices directly from people affected around the world. So I'll ask our producers to please begin that now.
Walan sila ng trabaho, walang kita.
दवाइयाँ मौके पे नहीं मिलती.
میرفتیم جلسه، میرفتیم اینور و میرفتیم مسجد نماز میخونیم. الان دیگه 3 ماه تو خانه نشستیم.
มันไม่มีเงินที่เราเก็บไว้มันก็หมดไป
복지관 같은 데 가서 내 취미 생활을 해야 되는데 내 취미 생활도 못하고 그냥 집에 어디 나가지 말라고 애들 나가지 말라고 그러니까 집에서 마냥 묶여 있습니다. 그래서 답답합니다.
मजदूरी करते हैं, काम करते हैं, नौकरी करते हैं. कोरोना और लॉकडाउन की वजह से इनके कारोबार खत्म हो गए हैं, इनका रोजगार खत्म हो गया है.
ใช่ไหมเราเป็นหนี้เขาอะทุกครั้งไม่เคยเป็นหนี้ถ้ามาเป็นหนี้เพราะอันเนี้ย جوری اینه که بیکار شدیم نمیدونم میترسیم از کرونا بگیریم سنمون بالاست دارو نیست
ผมว่าโอ้ป้าอยากได้ไว้เกี่ยผู้นายยังหวังอยู่ยังหวัง
As you could hear in the voice of the last participant in that video, there is a lot of uncertainty. I think we all feel it today. And what we aim to do in this event is not to provide pure clarity and certainty. We can't do that, but to really shed light on a critical issue and hopefully get us all thinking in a new direction. I want to tell you just a little bit about the event today, kind of lay it out for you, what's going to happen. First, we're going to hear from 2 leaders of the organizations that are hosting this event today, UNFPA and the World Health Organization. We want to get their take on this key question of the rights and well-being of older people around the world in the moment in time that we're in. Throughout the conversation today, we're going to be supported by interpreters. I want to thank them for their participation, Christopher Tester, Nigel Howard, and Deborah Russell, and everyone involved in interpretation. Thank you for doing that. After the introductory session, we will then move to a panel conversation with a number of experts from all over the world, and we'll dive a bit deeper into these questions of what does the future look like in terms of healthy aging, in terms of building the world we want and achieving the Sustainable Development Goals in a way that's inclusive of all people, including older people. We're going to have that conversation, and then we're going to end today with an action-oriented session, a session that's really about collective action, that's about what good practices we can bring and how we can make real progress, even in a tragic moment, on a critical issue like this. So again, that's a sense of how we're going to go through the day today. Those of you who are following us live from all over the world, we'd love to hear your contributions. Please throw out your comments, your questions into the chat conversation that's happening live on YouTube. If you're on Twitter, please continue the conversation with us there. We want to hear from all of you, and we appreciate your participation today. I'd like to see if we now have our two introductory speakers here to help set the scene. I know we have Dr. Natalia Kanem, who is the Undersecretary General and Executive Director of the UN Population Fund, UNFPA. And I think we may be waiting on Dr. Tedros Adhanom Ghebreyesus, who's of course the Director General of the World Health Organization. Natalia, maybe I can ask you to turn your camera on.
Tedros is here. Tedros is here.
Oh, he is. Wonderful. Natalia, turn your camera on, and Dr. Tedros, if you are there as well, we look forward to seeing your face. And we will begin our session. Hopefully you've had a chance to hear some of those voices in the video. And I know Natalia and Tedros, you have, of course, heard those voices from all over the world in this incredible moment. I mean, COVID-19 is affecting everyone, but we know how it is disproportionately affecting older people. And we want to hear from you today how you're thinking about that. What are some of the lessons that you're hearing? And so Dr. Tedros, maybe I can turn to you if you're there and ask you to begin.
Yeah, no, I prefer for Natalia to start because you already invited her, and ladies first. And
Tedros, please go ahead.
No, it's a great honor, actually. Please start, please.
Well, thank you, Raj, and thank you, Dr. Tedros, first and foremost for your life-saving work and for leading WHO so powerfully. As we set the stage for the conversation today, Excellencies, distinguished panelists, and everyone, I would like on behalf of UNFPA to first offer my condolences to those of us who have lost a loved one to COVID-19, including beloved older relatives, gone but never forgotten. Amen. This pandemic exposes the cracks in our societies, and they are huge fault lines of age discrimination, of racism and gender discrimination, and of discrimination by ability and mobility. Yet the pandemic also creates an opportunity. It calls on all of us to reset and to build a more equal world for everyone of every age group. Quality data is essential. UNFPA supports governments to rapidly generate disaggregated data about populations at risk, including what's happening in view of the relative and absolute numbers of older persons. Ageism, bias against elders, is compounded by multiple and intersecting other forms of discrimination. UNFPA always inserts a gender perspective into the analysis as well, to identify and to name the particular vulnerabilities faced by older women, because very often she didn't hold a job with a pension. She was not the one that had the property in her name. Coronavirus is an unfolding crisis, and all of us are learning as we go. Yet the data and the evidence that we do have already are telling us that age matters, that gender, race, poverty frequently spell the difference between life and death. So now we have to focus on the long term, and UNFPA joins WHO in urging governments to heed the evidence and to base plans upon the data. Very important to listen to older people. Raj, you've made that point. Prioritizing their needs in policy, countering ageism, and revisiting those laws and policies to ensure that older people's health rights and choices are protected. Across countries in Eastern Europe and Asia Pacific regions, for example, UNFPA helps ensure priority support for older persons and their caregivers. Our innovative demographic resilience program, for example, is being welcomed in Eastern Europe and Central Asia. Taking older people's issues to heart must become the new normal everywhere. So I'm just making the point that older people are also diverse. We need to include those who are living with disabilities and look at the ways that COVID-19 makes them more vulnerable, but more than anything, to feature their resilience and their wisdom, and to highlight the many positive roles that older people play. as leaders, creators, producers, volunteers, as grandparents, and certainly as historians and so much more. Older people's contributions are important during the COVID crisis too, as health workers and care providers, and in carrying the vision for how we move our societies beyond this crisis. So in closing, I'll use my favorite proverb on this topic, which is this one: the afternoon knows what morning only suspected. I'm asking you to take elders into account. Do not take them for granted. Older people deserve respect, outreach, partnership, and solidarity. And that's what brings UNFPA to the table today. And I am certainly willing and able to do whatever I can to chart a better path forward for older people. Adelante. Thank you. Back to you, Raj.
Thank you, Natalia. That was an excellent way to get us started. I do have to say, it has been pretty shocking to hear how quickly some voices during this pandemic have been to kind of think of older people as expendable, right? To suggest that well, this is not so bad because it only affects older people. And it just shows to me anyway, how the stereotypes that exist can actually play out in real lives and real ways and policy. It's been kind of shocking. And we know, and I very much want to hear, Dr. Tedros, your overall take on this. Everyone does. I mean, you're at the center of this historic crisis and doing incredible work trying to lead us all through it. And one key aspect of this issue I'm hoping you'll address, Dr. Tedros, is not only the direct health implications of this virus on older people, which we're more aware of, but the secondary effects, which have been very severe as well. So Dr. Tedros, let me just welcome you to the conversation. We're eager to hear your contribution.
Thank you, Raj, and thank you also, my sister Natalia, excellencies, dear colleagues, and friends. The COVID-19 pandemic has taken a heavy toll on many communities. As you know, older people have been especially hard hit. The case fatality ratio in people over the age of 60 is almost 15%, which is 10 times higher than that of younger people. This novel virus has revealed the vulnerabilities and inequalities in health and social care systems. Even before the pandemic, long-term care services were often under-resourced, neglected, and not well integrated with other parts of the health system. COVID-19 has exposed these weaknesses with devastating impact. In many countries, more than 40% of COVID-19 related deaths are linked to long-term care facilities, with figures as high as 80% in some countries. I want to express my sincere condolences to the families of older people who have died during the COVID-19 pandemic, joining my sister Natalia. Every life matters. Every life is precious, whatever age. We cannot allow the narrative that some lives are worth saving and others are not. This is wrong. I also want to thank all the older people, their families and communities, especially health and social care workers who have worked together to respond to the pandemic. As we just saw in the film, the pandemic has left people isolated from families and friends. It has made daily activities more challenging and sometimes impossible. It was very sad to listen to the people who have just spoken in the video. We have also seen the resilience of older people as health workers have come out of retirement to lend their expertise to colleagues on the front lines, while others have volunteered to support their communities. There are so many examples of solidarity between generations as young people do the shopping for older people during periods of confinement, or even just check in with them regularly. Since the beginning of the pandemic, WHO has worked with leading experts and partner organizations around the world to develop guidance to protect older people, their families, and communities. The guidance is focused both on COVID-19 and other health consequences resulting from the pandemic. The topics include infection prevention and control, clinical management, maintaining essential services for conditions such as diabetes, heart disease, and mental health, and the prevention of abuse and violence. The WHO has just released a new policy brief with 11 policy objectives to prevent and manage COVID-19 in long-term care facilities, from integrating long-term care in the national response to mobilizing adequate funding, to ensuring strong infection prevention and control, to providing support for family and voluntary caregivers, and much more. For each policy objective, the brief lists key actions that long-term care facilities can take and gives real-world examples of actions countries have taken in each area. The pandemic is far from over. We must work together to protect the health and well-being of our older generations who continue to give us so much. We owe them our best. I look forward to today's discussion, and I thank you. Thank you again, Raj, and thank you, Natalia, and thank you to those who have joined. Thank you so much.
Thank you very much. And I know we only have a few more minutes with you, Dr. Tedros, and with you, Natalia, until we see you toward the end of the session. Maybe I can just ask one quick follow-up question to you, Dr. Tedros. You have this idea that you pioneered at the WHO of a decade of healthy aging, and you put this out before there was a pandemic. Now the world has been hit by this pandemic. How do we think long-term in this way? How do we think about these long-term structural questions when we're faced with an immediate urgent crisis? That's probably what we're going to get into the next session of the discussion. And I'd love to hear your take on how you balance thinking about long-term inequities in society with the immediacy of a crisis right now.
I think both, we can do both. There is the urgency of saving lives now. And as I said it earlier, we have to focus on saving lives. We're losing more elderly people, and we should not lose lives, whatever age. And there are many good examples now, good practices, actually, best practices from countries, and sharing those now to countries so they can do their best to saving lives is really critical. So this is for now, and something that should be done. Then the second part with the long term is there are structural problems, inequities. And I think Natalia has already put a long list of all the challenges we face. And we have to include those in our long-term proposal or plan and address them. But it starts from learning our lessons very, very honestly. And really, honesty will be very important, central actually, to learning from this and say, never, never again.
Thank you so much for that, Dr. Tedros. And Natalia, one quick follow-up question to you. One reason this event is special is that the UN is coming together with this idea of collective action across this issue. And I understand there was just last week or a week and a half ago, the Secretary General put forward a letter emphasizing the UN's broad commitment across all of its agencies, including yours. Just explain for those who are watching this that may not understand the UN system as well, why does this matter so much for the UN to be working collectively and to suggest this is a high priority?
Thank you, Raj. Under the leadership of our Secretary General, Antonio Guterres, and of course, under the umbrella of WHO, as you've just heard, Dr. Tedros and his leadership on health, the Secretary General has made it clear that in every single instance, as the United Nations country teams valiantly come together and cover the world, we must bear in mind that this is not only a health crisis, that we are working with governments to shore up those structures, to dismantle all of the isms, and to listen to what it is that older people say that they need at a time when they're being the hardest hit. So we're grateful for that leadership. I think in every single country, our resident coordinators and the leadership of these country teams have expressed the desire for human rights to guide the work of the COVID response all the way up to 2030. Thanks.
Thank you. And I we're going to bid adieu to the both of you for now, and we move to our panel. And I know, unfortunately, in this world of virtual events, you can't hear the applause, but I promise people at home are applauding you and joining me in applauding both of you for those great introductory comments. Thank you so much. And I now want to bring our panel. Thank you, Natalia, Dr. Tedros. I want to bring our panel to the fore. I'll ask them to turn their cameras on if they might. We have a group of experts from around the world who are going to help us dig a little bit deeper into this issue. I want to welcome Arun Maira, who is the chair of the board at HelpAge International, Dr. Alex Kalache, who's the president of the International Longevity Center in Brazil, Christine Umutoni, the resident coordinator for Mauritius and the Seychelles, Dr. Naima Al-Gassir, the senior advisor to the WHO in the Eastern Mediterranean region, incoming representative for WHO in Egypt, and Octavio Vergara, who is the director of the National Services for Elderly in Chile for the government there. Welcome to the conversation, all of you. And you heard, I think, a really compelling set of introductory remarks there, helping to set the tone for the discussion today. But maybe, Arun, I can turn to you and ask you to take us a little bit deeper in terms of what has this pandemic meant for older people. Obviously, it's a very diverse, massive population across the world, many diverse experiences, but how have you thought about what this pandemic and the response to it has meant for older people? And you're on mute if you don't mind unmuting, Arun.
Thank you. Yes, we must hear the voices of older people, and I'm an older person. So thank you for the privilege of me speaking as an older person on behalf of older people in many countries of the world today. Raj, what we have learned from the pandemic is that many factors contribute to human well-being, and all things must be considered before prescribing any strong medicine. Indeed, this is why we are being so careful in testing new medicines for COVID before releasing them for public use. Now, lockdowns are a strong medicine to save lives from COVID. They have harmed human well-being in many ways, by other medical problems that could not be attended to, and even by starvation in poorer countries due to disruptions in the economy. Raj, what we have learned from the pandemic is that we need local system solutions developed and implemented by communities to solve such complex global problems. Communities understand their local needs and know their local capabilities better than remote experts can. It's sad that economic progress is being pursued too much with a paradigm of the large and the global which is dominating. It must change to give more voice to the small and the local, and that is the only way to preserve the environment and to improve human well-being. Consumerism with consumers using and discarding things is driving GDP growth. Sadly, this use and discard syndrome is being applied even to human beings in the economy. Workers are used and discarded by big businesses when they're not required anymore, and older people are shunted aside when they're no longer useful for the economy. The solution to the problem of older people, unfortunately, has been to keep them in separate homes, with their out of sight and out of mind, as the horrific death rates of older people, even in the most advanced countries with otherwise good health systems, has revealed during this pandemic. Well-being is created by generations nurturing each other within communities. In HelpAge, we are focusing on listening to older people. You saw the videos at the beginning. The older people say they do not want to keep adding years to their lives. They want to add life to their remaining years. They want to be integral to the community. We must remember that without them, we would not be here, nor our children and our grandchildren. We have found before the pandemic, and in it too, that intergenerational self-help groups, as Dr. Tedros mentioned too, with elders at their center though, what I'm pointing out is elders at their center are powerful institutions for rallying community action. These are the seeds of local system solutions for the many complex problems that have been listed in the SDGs. Global demographics have changed, Raj, and the UNFPA has been reminding us. In 2018, for the first time in human history, the number of persons over 65 years exceeded the number of children below 5. So let us respect.
And Arun, that's a sign of success, right? Organizations like UNFPA and other development organizations, they think about how can we extend life and how can we reduce fertility, allow for family planning. And this is a sign of a world that's progressing, that it's becoming more developed, is that we'll have an older population.
Yes, but the way we have organized our economy and also systems in our society, because we discard the older people, they're no longer useful in the economy as designed. So they become a problem. So the larger the number of older people, the greater is the problem for the world economy, as we know.
Right. We think of them in terms of a burden, a pension system required, expense, health expense.
The older persons are the world's fastest growing and so far least used asset that humanity has for its sustainable and inclusive growth. And I want to say, older people like myself, hopefully, should be seen as the solution and not as a problem.
I appreciate you starting us off with that frame, because the narrative is so important. As you say, the way we think about older people can lead to policy decisions and lead to societal frameworks that ultimately have the kind of impact we're seeing during this pandemic. So I want to bring Dr. Alex Kalache into the discussion, because you have been thinking about these issues for a long time and how we frame them, especially with regards to the UN system and its role here. Maybe you can, Alex, you're on mute, but if you take off your mute button and just maybe share your reflections at this point in the conversation.
Thank you very much, Raj. It's an honor to be here. And I should, like Adam has just said, giving my good morning to Dr. Tedros and Dr. Cannon, that I'm not here as president of the International Longevity Center Brazil. I'm here as an older person. It is
Alex,
very nice to be.
You, sorry to interrupt, but could you lean a little closer to the microphone? We hear you, but it's a little bit choppy. Maybe that will help.
I hope that it is better now. I was saying that it is very nice to be here as an older person, because our voices have been silenced. And this is not only in Brazil, this is throughout the world. It matters to us so much, and yet we are silenced because the governments, the member states are not interested to hear our voice. Above all, I want to break the protocol. I know that we are not supposed to be showing slides, but I'm going to show this photo. And this photo is my mother about 8 years ago. It's a very special day for me because she's turning 102 today. And no, man, you are not disposable. You are precious. You are not the vibrant woman that you used to be, the woman that throughout my life encouraged me and supported me and looked after my father so well when he was terminally ill. And it's not going to be now, man, that they are going to tell you, you are disposable. We don't care. Those messages that, and so what? You have already lived. No, man, you count. And I am going to make sure that you are going to be looked after. Because whenever we have an emergency and a crisis, we need older people's voice, their resilience to show the light at the end of the tunnel. In all crises and emergencies, this has always been the case. It's not going to be different now. It's us, older people, that are going to embrace and restore that community. We may be frail, we may be vulnerable, we may be at risk, but above all, we are resources that are going to count. And this is especially important, Raj, when we see inequalities rising throughout the world. Especially if you are a woman, if you are disabled, if you are sick, particularly if you are poor, Black, migrants, indigenous. All this counts in order to make this very sinister, very toxic combination. But we are not disposable. We are going to fight for our rights to the end. And again, when we see inequalities rising, the Oxfam yesterday has shown us that the number of billionaires in my continent, in Latin America, has risen by 49 more billionaires. And yet 50 million have plunged into misery. I'm not talking about poverty. This crisis is not only sanitary, It is economic, it is education, it's environmental, it's cultural, it's humanitarian, all made worse by ages. Our voices count, and we will shout. Our rights count.
Thank you
But
so much,
governments
Alex.
are not listening to us. Governments are not listening to us, and this is why it is so important to have the UN system. Because I tell you one thing, that together we will be stronger. More than ever, we, civil society, need to be empowered by the UN system response. But the UN system response also needs our voice in order for them, under attack by many governments, to feel stronger. We need to bridge this and to have very effective ways for the UN system to work solidly with civil societies, us as well, needing them.
Thank you so much for that, Alex. So many interesting things there. First of all, I appreciate you shouting because we can tell your passion in this conversation, and it's much needed. This is not just a technocratic issue. This is something that we all need to really examine. How do we want our societies to look? I also want to say a big happy birthday to your mother at 102. That is remarkable. Congratulations to her and to you and to the whole family. And thank you for bringing that example to all of us. I want to bring Christine Umutoni into the discussion. You began, Alex, talking about the requirement of the UN system to take this seriously, and Arun talked about how in the end, these are things that have to be dealt with at a local level, at a community level. And really that's what you think about every day, Christine, as a resident coordinator, as somebody who's thinking about how do we get collective action, but at the country level. So tell us a little bit more about your reflections on that point.
Thank you very much. I hope Dr. Tedros and Dr. Natalie are still around. Hello to them. In Mauritius, and I cover Mauritius and Seychelles, but I will focus on Mauritius, the issue of, or even the conversation around population aging in a healthy way started way much earlier than COVID. You will note that in the population dynamics in Mauritius is quite unique. I have worked, I'm a Rwandese, I've worked in Rwanda, in Zimbabwe, I worked in Eritrea, but this is where I saw a different curve. The population here, the older population is more than 15%. So we noticed this way before and rallied the whole UN to think through it. And I think this is where coordination before crisis, during crisis, and after crisis is very key. Because for us, it helped us where, led by UNFPA and WHO, we started to analyze the population dynamics and to look for policies which can address what we have here. And we came up with looking at population aging and promoting well-being of older people as part of our plans. But to be able to have a high-level engagement, I actually did lead a UNFPA delegation to the Prime Minister's office and to the Minister of Health to have this conversation and ensure that health aging is part of the national agenda. So by the time COVID was hitting us, we already had done the country analysis, which addressed health aging, and we had a cooperation framework by all the UN members. And of course, during its elaboration, here we have what we call the Mauritian Council of Social Services, and we have the Mauritian Association of Elder or Senior Citizens, as they call themselves. So all these were consulted, and we already had then a cooperation framework where outcome 2 is talking about a comprehensive approach to address challenges posed by population aging, and outcome 5 is talking about social protection policies that bring all the most vulnerable. So anyway, what I wanted to bring really to the focus is that through this engagement, and maybe what COVID has showed us, is that what we had planned with COVID, it looked more obvious. It brought a sense of urgency. And as I talk now, the National Population Policy has been passed by Cabinet, and it clearly lists out a number of interventions for the elder population. The WHO National Health Strategy has also been passed. So our emergency response plan for COVID involved thinking about older persons, because for us, older persons are actually a gold mine, and maybe different from, older person in every country must be respected. Older persons in a country where 15% of the population, the curve has turned, is even more urgent. So, I won't go into the details, but UNFPA, UNDP, OHCHR, WHO, all in their different roles, like UNDP with the social registry, UNFPA with mapping the vulnerable people, OHCHR with the voices, WHO with clear interventions. And if you allow, a few of the interventions that practically, for example, during COVID, door-to-door vaccination of older persons in their home, payment of national pension to elder people, door-to-door, elder persons having priority access to everywhere, and so on and so on. So moving forward, we have identified that we're working on the socio-economic response plan, and also we will continue the cooperation framework, both of which have those priorities identified. And also the structures that are in place that will help us monitor this. We have a high-level committee on COVID on which WHO actually sits. We have another high-level committee on which the UNCT also sits. We have the Development Partners Forum, the private sector and civil society. And so we have put in structures, but which all help us to address this. My conclusion is that a coordination effort helps us see things through and bring solution that is not piecemeal. Addressing population dynamic in Mauritius, where you have a large number of people over 65 years of age, it requires consolidated effort. It requires high-level commitment from the government, and it requires focused sort of interventions and policies. So I would like to thank you and stop there. I can answer questions, but definitely
Thank you, Christine.
Coordinating has been key.
Thank you so much for that, Christina. A lot of interesting threads there that we can pick up on. One important one to me is that in any crisis like this, we also lay the groundwork in our response for the future. And as you say, a response to this crisis, we can think about bigger issues like healthy aging and where that fits in and how do we design the systems for that. That's something we'll get to in a moment. You also talked about something that I think Arun began the conversation thinking about older people really as an untapped asset, not only as people who are vulnerable and need protection, but actually many of our frontline healthcare workers, our teachers, our leaders, our business people, many of the most productive people in society, the people who we're turning to in a crisis are older people, and thinking about how do we utilize them as solutions in this crisis. And that's why I want to turn to Dr. Naima Al-Gassir, because she has, I think, some great examples from her experience at the WHO when older people really are the key. And I know you've got a number of examples, but I thought maybe you could share with us particularly one that you had shared with me earlier from Iraq and your time there, Dr. Naima.
Thank you very much, Raj, and thank you for following a very difficult path after Christine, but she brought it to the context. And following on the things, I would like to bring an example where it's from history to bringing lessons learned and opportunity with COVID. This is the context of Iraq in a very complex humanitarian emergency situation, where we had a report of 2 first cases died due to avian flu in Iraq. That's the context. There were 3 governments, Iraq, Kurdistan, Sulaymaniyah, and Erbil and Duhok governments then. The older persons were the solution, were the strong voice, and they were the inclusiveness in terms of bringing health at the heart of the economy then. What do I mean? Because the village, Sarkab Khan, that was affected, where the whole community lost their livelihoods, the whole community was stigmatized, and there was a discrimination that already was mentioned by the esteemed speakers earlier. What happened then? The solution was the older persons were opportunity. First, the woman, the older person, then she was about 70 years old, contacted the UN, WHO, to say this how much this community is affected. It moved into the older persons organized for the UN integrated mission, facilitated, engaged with the government, including the Prime Minister, to bring the solutions at the Mukhtar level to reach these communities and change and shift. So they were influential, they brought the wisdom, and they worked with the youth and the families to more of psychosocial angle of it. In terms of addressing it, they were identifying the problems. The older persons told us about the lack of water, safe water, the slaughterhouses, where are the problems and how can we go to it? Where are the private sectors that can bring the solutions? These are all solution voices that was brought to us. They were inclusive in decision-making on how, as an UN integrated mission, because that was Iraq then, with the WHO-led mission, where we had CDC Atlanta, CDC Europe, civil society, NGOs, and the media. Why I say the media? Because the older persons believed that we can demonstrate and change the stigma against these communities that had all the callings, all their livelihood, or socio-economic change loss, that they can shift and they can present on hand washing, on how to take care of their livelihoods in that communities. What happened? We utilized all the guidelines and the policies of all the UN agencies, which today we heard for the current. They prepared as an opportunity for the future. They brought the hope and the wisdom. And at the same time, they brought men and women, that's why I said men and women, inclusiveness in the decision-making. 3 governments. When you walk into the first government like Suleymaniya, you will see the older persons who are not ministers, who are not presidents, who are not parliamentarian, are from the community to make decisions. And that's what Dr. Arun was talking. And it was from community, from the locality that was actually addressed. I didn't talk about the other examples, but in this one, the youth was influential because there was trust, there was respect to the older person. So the values of respect and trust are needed. It's not that they are not vulnerable, but they are also bringing the solutions. And that was a very positive experience that we had. I want to bring a wrap up on what Christine said, our collective actions, our integrated approach. Already we mentioned about the UNFPA, you mentioned about WHO, UNHCR, UNHCR, because I'm from a region, we have a high number of refugees displaced because of the conflict. And COVID-19 has added to this complex. So our concerted action, bringing the voice of the older persons, to bring the rights of the health for all by all, that means inclusiveness. Also, we have gone to the field to say, as WHO, how can we have revision of the health systems, services, and bring guidance to the countries that they can implement in an integrated approach with other UN agencies to actually serve the ones who are vulnerable. So we talked about the vulnerabilities, but also about the opportunities. And these guidelines already are online, so I will not refer to them, but it was for elderly home care, especially for the infection control, but at the same time for essential services such as diabetes and cancer care, and at the same time hypertension. I think we need to look at the lens of equity, and I want to the protection of health is our goal for the community, for the economy, and for the development. Thank you very much for this opportunity. You can ask
you, Dr. Naima,
later on Egypt.
Yes, no, I very much appreciate your intervention today and for grounding the discussion in a real example. And it shows you, if we design the community in a way that is inclusive of all voices, what can happen. And also what the cost is when we don't. When we think about dividing people up and leaving them apart, what the cost is as well. So thank you for giving us a really clear example in context today. I do want to just mention we are now joined by Dr. Naoko Yamamoto, who is the Assistant Director General of the WHO in Geneva. We'll be coming to you shortly for the last section. I just want to welcome you to the discussion since everyone is seeing you on their screen, and thank you very much for being here, Dr. Naoko. But as we round out this section where we're taking a deep dive into the key issues affecting older populations, I want to turn to Octavio Vergara, who as I mentioned earlier, is with the Chilean government. Octavio is the director of the National Services for Elderly, or SENAMA, in the country. And we've heard a little bit about this term, healthy aging, Octavio, but I think you bring real expertise to that question. Chile is a real leader on this idea of healthy aging and designing, almost architecting communities to be healthy for older populations. Tell us more about what that is, how that actually works.
Well, thank you, Raj. And let me first thank also WHO and UNFPA, also HealthPage International, for organizing and promoting this important event. Yeah, a key action to our plan regarding COVID was to act articulated. Since the beginning of this pandemic, we implemented a close collaboration between the public sector, especially the Ministry of Health and Social Development, NGOs, but also, and very important, older person representatives and the private sector also. And we based this strategy in two main aspects. The first one was to try to improve the life quality of people living in, older persons living in residence, in nursing houses, and also persons living in their own homes. And to implement that, we developed a local strategy based on this smart health community, which has mainly three aspects regarding long-term care facilities. First was ensuring prevention, the continuity of care, and isolation of COVID-19 cases. On prevention, we developed a monitoring platform for case follow-up, technical support from infection disease expert, free delivery of personal protection elements, implementation of sanitary barriers at the centers, and preventive PCR testing, which was really important. Regarding the continuity of care, special training programs for carers, while ensuring staff replacements in the case of virus outbreaks were implemented. And finally, within the isolated cases, transitory residents have been activated through all of the country. We have more than 15 residents activated just for isolation cases that come from nursing homes. This is important because with that plan, we were able to prevent people getting sick, but also when the virus started in the residence, trying to promote an active and important care. And for all the persons living in their houses, a mental health plan has been set in place, which involves the opening of older person hotlines for information and emotional support, a telecare program, a food security program, and a set of specialized exercise. We are fully aware, Raj, of the need of mental health support, and our commitment is to reinforce the intersectional work on this field. Chile is halfway through the emergency, but our sights are set on how this pandemic can be transformed into an opportunity of improvement. Now, we think more than ever, it's time to develop a strong work protecting older person health and human rights based on a social sanitary approach, including the age-friendly city model, in response to our duty to provide a better protection, dignified treatment, and greater well-being for older persons. And let me just say, Raj, that we have an amazing example of older person representative. We fund this strategy based also in a fund that we have for older persons organization. They decided to transfer the money of this fund that is for clubs and for travel and all of different things to protect older persons living in resident houses. So older person representatives decided that they will not use the fund for this year to make sure other older persons were protected within this virus.
Thanks for that example, Octavio, and for giving voice to that community and giving them that choice and hearing what they do. I also appreciate you bringing the issue of mental health to the fore. We haven't quite gotten into that too much in the discussion today, but of course it is a major secondary impact as you have millions of older people who are cut off from family, cut off from support, stuck on their own in many cases. It's a really important issue to bring up. I appreciate you adding it to the discussion today. The time is flying by. And really, we need to move to the next section of the conversation. So once again, I want to thank all of the people who've just contributed to the discussion and give you, kind of a virtual applause from from people around the world who are following this. Thank you so much for those really interesting contributions, all of you. Again, thanks, Dr. Arun Mayra, thanks, Dr. Alex Calache, Christine Umutoni, Dr. Naim Al-Gassir, and Octavio Vergara. Thanks so much for your interventions today. And I want to move on to our final set of speakers as we hone in on this idea of collective action. What can we actually do? The spirit of this event is to raise these issues, but also to see that there's a plan to actually achieve something. And so with that spirit, I want to bring in Laila Baker, who is the Regional Director for Arab States at the Development Coordination Office. Welcome you to the discussion, and Claudia Mahler, the independent expert on the enjoyment of all human rights by older persons. And of course, we still have Natalia Kanem, who is the Executive Director of UNFPA, and I mentioned Dr. Naoko Yamamoto, who is also with us for this conversation. Maybe, Laila, I can just turn to you to begin. How do you, from a development coordination standpoint, see the importance of the UN working together on a broad agenda for the rights and well-being of older persons?
Hi, Raj. Good morning, good afternoon, good evening to everyone. Thank you so much for inviting DCO to participate in this really important webinar. I have 3 messages and 4 action points, if you'll allow me. The first is around the vulnerability and the context specificity of older persons and that diversity that we need to bring within the UN system. We've heard a lot today about COVID-19 and how the mortality rates of older persons have shown their disproportionate vulnerability. That's all true. But it's really important to keep in mind that it's not just age that's the only factor of vulnerability, but more importantly, the circumstances around which individuals find themselves that makes them vulnerable to the pandemic and to certain other social protection elements. So as we go forward, we have to understand the circumstances and patterns in which mortality is the highest. We've heard today that in certain circumstances in the Americas and Europe, it's the nursing homes that are the focus of the pandemic. In other areas like the Arab region where I would live and work, it's the rural communities and it's the people who are impoverished because they have lack of social protection, insurance, or there's neglect of older persons. And by understanding those specificities of who is vulnerable to COVID, especially their heightened risk of mortality and why that's happening, then we can begin to mitigate the circumstances more effectively as a team. So that kind of brings me to the second point around the need for data and information. And we heard Dr. Kanem, we've heard just about every speaker here talk about the importance of having that information. And if anything, there's a silver lining to this dark cloud around COVID that yes, older people are dying much faster than other people in the population. But we've also got a highlight around the need for information. We have more people working on data and statistics. And so what can we do to embed that within our systems for regular monitoring and analysis? And here's where the UN and its partners need to work with national data specialists in capturing that evidence surrounding the situation of older persons, but in a much more granular, nuanced way. I feel very strongly about lumping everybody into one group. As a woman from a generation where women were the most vulnerable, I feel strongly that we need to also capture the individuality of people, and I'll come to that in my third point. But the resident coordinators, and I'm so happy to have Christina with us here, the resident coordinators had the UN country teams and they do their analysis on what is the core of the UN work. And our mantra is leave no one behind. That means that we have to ensure that the vulnerability elements of all of the populations, and in this case, those that are related to older persons, are embedded within the United Nations frameworks. We have a unique opportunity here because COVID has given us a rather short window on a new framework where everyone is coming together. It's called the Global Humanitarian Response to COVID. And we have a second one that talks about the socioeconomic response. And both of those plans now include the elements of older persons and their vulnerability where they exist in a much more granular way. That brings me to the third point, and my third and final message here is understanding the socioeconomic contribution of older persons. The other thing that the UN is hoping that COVID will do is to allow for us not to just generate the old paradigm, but and Dr. Tedros spoke a little bit to this. What does it mean to build back better? So we are presented with a unique opportunity where the health situation has been catastrophic for older persons, but it's also allowed us to have an eye on the health and rights of older adults. And it's also allowed us to sway away from just the categorization of older people as vulnerable, which sometimes can stigmatize them within a population. But we've also can also contribute to ageism, which we don't want to do. It's important that we keep an eye on and a sense of the diversity and individuality of the older people embody. So what's the UN going to do about this? In our longer term policy and programmatic responses, we can recognize the productivity and quantify that, both on a social level and an economic level, and embed that within the frameworks that we're working on. And here I'd like to just pay tribute to the fact that older persons within their community are a source of family stability, social cohesion, and the more we can produce the evidence on the benefits of older persons remaining active in the labor market and in their societies, the more easily that we can contribute to overcoming those negative perceptions around their integration within the frameworks. So what are the commitments that we have? UNDCO, I'm very proud to say, is the newest member of the Interagency Group on Aging. And that will allow us to pay more attention to how we're going to translate the Secretary General's call to action on human rights and ensuring that older persons are embedded within that promotion of a rights-based approach. We'll do that by having a strong evidence base, working on the data information around older persons from the country level. And in special cases, we can use the platforms that we have at the regional level, all of the regional directors from the agencies who are here and a whole spectrum more, on building coalitions of people who can then also work and promote that dialogue with civil society at the national level that we've heard so much about. And we plan to step up our efforts around that to mainstream older persons. I think that we can do a whole lot better from what I've heard today from our counterparts. Working with WHO, UNFPA, DESA, OHCHR, and the whole spectrum of UN partners. Because defeating this pandemic and curbing the death toll will require action to shield older persons in a much more determined way to recover better. UNDCO is fully committed to do that. Thank you so much for your attention. Over to you, Raj.
Thank you so much, Lila. I'm a little worried about the time, but I didn't want to interrupt you because you were getting to the meat of this, which are the actual commitments, and that's really the purpose of this last segment. So I am told by the organizers we can go a few minutes long, but I do want to be sensitive to the time for all of you who are joining. So let me just ask you, Claudia, to please join the conversation. We'd love to hear your take, especially with a human rights frame, to what you see as the opportunities for collective action.
Okay, thank you so much, Raj. But first of all, I still would like to thank the organizers because I think this is really key today. And I really would like to thank them once again to invite me on the capacity as United Nations independent expert on the enjoyment of all human rights by older persons. The pandemic really exposed dramatic human rights violations, which affected older persons disproportionately. We already heard this. Therefore, we have to join our forces to construct a more inclusive society based on non-discrimination and equality, respect for human rights and dignity. Older persons are one of the most heterogeneous groups. We already heard this. And they are not only frail and vulnerable, they had many positive contributions during the pandemic. We really need to keep this in mind. And we also have to change our images of older persons. I like the expression of the gold mine. Thank you so much. Ageism and age discrimination came to light during the pandemic, and in the worst cases led to violence and abuse. The discrimination on the basis of age, including withholding or refusing the provisions of medical treatment based on age limit or social worth, is simply prohibited under human rights law, and we really have to take this into our consideration. I would also like to raise one other issue. During the pandemic, we witnessed the impact of the digital divide, where digital exclusion impeded older persons' access to the essential information about the pandemic, as well as related health and socioeconomic measures. We also have to keep this in mind when we are building back. The lack of a comprehensive and integral international legal instrument to promote and protect the rights and dignity of older persons continues to have significant practical implications, including for older persons in emergency situations. So we really need to work together in this at the open-ended working group and on the national level. I would like to seize this opportunity to call for action. Older persons are paying the price for their invisibility. We urgently need a global strategy to safeguard older persons during the pandemic and in the recovery and thereafter. The SDG policy brief on older persons has been a first and crucial step for a joint vision and commitment, along with the UNFPA technical brief, the WHO briefs, UN DESA brief, and many other documents dedicated to older persons and COVID-19. We need to build on this commitment towards a policy plan and strategy that would allow for a systemic approach to older persons, making them visible, working for inclusive equality and integration. Such a strategy should guide the UN system and states in the implementation of the SDGs through age-sensitive and older persons' rights programming. This was it from my part, a very short one. Thank you, Raj.
Thank you so much, Claudia, for an excellent intervention. And I particularly liked your phrasing of the older people paying a price for their invisibility. And really, I think that's a perfect frame for what this event is about, is trying to erase that invisibility and really listen to the voices of older people and raise the profile of these issues. And with that, I would like to ask Dr. Naoko Yamamoto to join us with your reflections. Obviously, this is an incredibly intense time at the WHO, and we appreciate you taking time to just give us your thoughts about how the WHO, in the midst of this pandemic and crisis, can think about prioritizing the rights and well-being of older people. What are your reflections, Doctor?
Thank you, Raju, and this opportunity. I think that global community, we have not done enough yet for the aging society and the older people. But it is not only that during the COVID-19 period, it's before the COVID, we didn't do enough. But we think that many other speakers has already said that we think this is an opportunity to highlight dignity of the elderly people and highlight to the human rights of the people. So let me say one word, the commitment, WHO's commitment. What is the WHO commitment? WHO's commitment is put its all entire efforts together with all partners for healthy aging and a world that treat older people with the dignity and deserve. That is the world WHO wants, and what's the world we will work together with everybody. Let me stop here. Thank you.
Thank you very much for reiterating that commitment, and it was a pleasure to hear your voice as well added to this discussion. Natalia Kanem, the Executive Director of UNFPA, you're back with us, and I just wanted to give you that chance to share with us as we close out the program today, your commitment at UNFPA, what you see as the action steps we can all take as a community to drive these issues forward.
Well, thank you, Raj, and thanks to all of the partners, WHO, the Office of the High Commissioner for Human Rights, UN DESA, the Department of Economic and Social Affairs, and of course, HelpAge, for bringing us together for this call to collective action. And we have to heed the call. And we've heard that older people say that we need a strategy and a coherent policy, systemic framework to look at issues which literally are issues of life and death today under COVID. For UNFPA, we are committed to continuing to work with all of you. I am gratified that we have so many hundreds of people in the chat room on YouTube right now, and we're taking notes as to what the advice is that is being given so that we can mobilize together with governments, but also very crucially with older people whose demands have to be incorporated. And I think we're coming to understand that we have to denounce abuses and any type of even violence that's perpetrated against older people during this pandemic. The disability nexus with aging also has to be incorporated into our thinking. And we heard the example of communications. What if you are blind, or if you have mobility issues, or you're not on the web? Very important for us to commit to overcoming any obstacle. I think we've heard that we have an opportunity. we must transform our ideas. Our imagination has to be called into play. How are we going to build back better after this pandemic and make this crisis a turning point? I'm really, really happy to see that there was no doubt in anybody's mind that there is more that needs to be done. I'm grateful for the leadership of the Secretary General and our UN country teams and civil society. Together, we've got to fashion the road forward. Adelante, siempre. Thank you, Raj.
Thank you so much, Natalia. And you brought this word imagination to the fore, and I want to underline that for everyone. One takeaway for me, and it's been stated by many of our participants today, is that the world has been aging. Populations are getting older. In many ways, it's a sign of development success. It's a sign of human progress. And we've known that these gaps exist, right? We've known them by age, we've known them by gender, we've known them by many other areas that we have real inequalities in the world. That wasn't new, but this pandemic has laid those inequalities bare in such a stark way. It really should shake up the whole world to realize how deep these inequalities run and how urgently they need to be addressed. And they do require an imagination for us to see a new world, for us to envision what is the world we want to build. And oftentimes it's in a crisis like this that the seeds and the groundwork are laid for what that new world is. This is also that opportunity that's coming through so clearly from the many participants today. So it's been an honor to be a part of this discussion. It's something, of course, we at DevEx are covering actively, and we appreciate the chance to be a part of this today. I just want to ask all the participants who are still with us, maybe turn their videos on. And as we just close out the session, it would be great to see your face as we say goodbye. On behalf of everybody who's out here today watching and following the session from around the world, I know they're all applauding your participation. So thank you, and thanks to UNFPA, the WHO, and all the organizers for a very successful event. Thank you all.
Thank you. And happy birthday to Mama again. 102, wow.
With a lot of determination.
Happy birthday to her. It's an honor for us also, Raj. Thank you. And thank you, Dr. Natalia. Thank you, everyone.
Delighted. All the best.
Bye.
Bye.
Thank you. Bye.
Bye.
Bye-bye. Thank you, everyone.
Thank you and bye-bye.